So I'm a retired Army veteran. I spent 26 years in the U.S. Army, culminating my career as a Master Sergeant, retiring as a Special Forces Combat Medic or Special Forces Medical Sergeant. I retired January 31st of 2021, earlier this year. As a Special Forces Medical Sergeant, I work closely with a small group of 12 people, providing all medical support as needed. And as a combat medic, I'm a combatant first until medical aid is needed, at which point I withdraw from the fight and provide the medical aid as needed. Okay. My plan retiring, separating from the military, was I still have a wife and kids I need to support, and I needed to transition into another job to fulfill that role. With a medical background, so to speak, as a combat medic, I thought nursing would be a good fit. So I looked and shopped around at some colleges, and Okaloosa Technical College provided a fast track to get my LPN license up and running as quickly as possible. So as I'm about to finish up with my LPN here, I've basically seen all aspects of the LPN program at OTC. It is very condensed and very fast paced, which I personally like, but it can be challenging for some. With some knowledge of medicine going into it, I felt like I had an advantage in the beginning, especially when it's covering vocabulary and some of the basic pharmacology methods. And of course, my background was in trauma, so I started to struggle a little bit when I was getting into the different types of precautions, whether it be airborne and droplet, and the types of treatments done in a hospital setting, because all of that was foreign to me. Some of the tests were pretty intensive, but I powered through them all, and I feel like I actually shared some of my experiences with the instructors and other classmates. So it was a well-rounded and balanced educational process. So we have 3 semesters here at the college. There's 2 instructors per semester. The core class, the freshman semester, they understand that everyone is coming in and they don't have a lot of background or may not have any understanding of the medical field. So they really take a lot of extra time to make sure they explain everything in depth to make sure you comprehend it before you can move on. So the core class is very accommodating to people that don't have a background in medicine or know anything about it. And they really do assist you along as far as you possibly can. But then as you transition into the upper classes, they basically take more of a hands-off, use your critical thinking skills. We're here if you need help, but you need to figure this out to the best of your knowledge on your own. If you're struggling, let us know. We will help you get through it. And then as a senior, you're almost on autopilot, and the instruction is still there, everything is still provided for you, but they want to see you use your own critical thinking skills. As always, the assistance is there if you ask for it, but they want to see you use your critical judgment and power through. So my core class was a little bit different than most because we were still suffering through the COVID pandemic and we were not allowed to do any actual on-site clinical rotations. But we worked in small groups to the SIMS laboratory here on campus where they have the mannequins that can talk to you, breathe, check their pulse and everything else that goes along with a live patient. So they keep you working in groups and they have you collaborate back and forth. You give a report on your patients and the next person sees what you missed or what you didn't miss. And then moving into the junior class, you actually work in the field. I was able to work at Twin Cities Hospital, where I would get assigned to a nurse on the floor and would shadow them throughout the day. Based on the nurse you have, the experiences vary, and you get out of it what you put in. The more you ask them, the more they are willing to share with you. If you're just watching them, you're not going to learn as much. You need to get involved. And they actually want you to get involved because you're the up-and-coming nurse that will possibly be sharing the same patients with them later on. So when you get on your clinicals, you have to do the checkoffs in the classroom first so the teachers can verify that you actually do know how to provide said treatments. And then if your nurse is comfortable, they allow you to do all of the patient care within your scope of practice. But as far as patient care, I've helped with wound dressings, passing medications, giving injections, assisting to the bathroom, bed changes, bed baths, basic patient grooming, shaving patients. Basically, how stable the patient is how much the nurse will allow you to do. If they're a stable patient, you will basically be that patient's nurse for the day. One of the benefits of doing the clinical rotations as you're about to graduate is you get to see the facilities in the area. We rotate through quite a few different facilities that the school has contracts with. And going through them, the nurses there see you, and I have been offered multiple jobs at several different institutions. I do know that there's work out there, and I'm excited to get going. And the fact that I've been able to spend days in different facilities, I already know which facilities I like better than others or what department I would like to work in. So pending passing the NCLEX post-graduation, I already know there's several agencies here that are willing to hire me on. If you're looking for a nursing school, I would highly encourage you to look into Okaloosa Technical College. Not only is it an accelerated program, it is cost effective. The price is lower than most, and you get through it with the same licensure as any other school.